there's a presidential race going on, and one of the main topics that the candidates are speaking about is healthcare. See, some want to repeal the Affordable Care Act, some would like to expand it, and then one wants to get rid of the entire privatized healthcare system and switch it out with a socialized healthcare system. And some people are not aware of what a socialized healthcare system is, and we can look no further than the United States' closest ally, the United Kingdom, to see what a socialized healthcare system looks like. See, the United States is privatized while the United Kingdom is socialized. The UK's healthcare system is paid by the taxpayers through their taxes, while the US citizen is responsible for going and finding a healthcare plan that suits them. The United States healthcare is provided through private insurance companies, while the United Kingdom is through the National Health Service, otherwise known as the NHS. The United Kingdom bases healthcare in the idea that it is universal and free for all of its citizens, while the US has people be responsible for going and finding an insurance company that will provide them the plan that they can afford. The US government often likes to stay out of the private medical industry, with some exceptions like Obamacare or the Affordable Care Act. According to the Department of Health and Human Services, healthcare premiums will increase 7.5% in this next year. The United Kingdom's government regulates healthcare through the NHS, which was established in 1948. There are downsides to the NHS because sometimes people have to wait longer for operations and treatments. The way the healthcare systems are paid are dramatically different. The US, it's all on the people. They have to go out to these insurance companies and find a plan that suits their financial situation. And if you do not have money, oftentimes you are not getting insurance. The United States pays for insurance that covers medical expenses, but if the plan that you have does not cover the medical expense, you'll have to pay for the rest out of pocket. Yet, in the United Kingdom's healthcare services are paid by the taxpayers. This makes most appointments, blood tests, and operations free for citizens. However, you are charged for dentist appointments, eye tests, and prescriptions, which is similar to the United States healthcare system. The medical field workers in the United Kingdom is paid by these taxes. A quote by Uwe Reinhardt, a professor of political economics at Princeton University, said, "The issue of universal coverage is not the matter of economics. Little more than 1% of the gross domestic product assigned to health could cover all." So not everybody in the United States feel that privatized healthcare system is the way to go, and some would like to switch to a socialized. One of the most dramatic differences between these healthcare systems is how healthcare is provided. The US uses these private companies that provide insurance and healthcare plans to the American people. One of the benefits of the United States healthcare system is that they have more freedom to find and pick a plan that suits their financial situation and suits them. More than 40 million Americans before Obamacare did not have health insurance. Plans help cover medical expenses for the American people. In the United Kingdom, the NHS is fully government ran. It's the largest employer in the United Kingdom, and all the doctors, nurses, and other medical workers are paid through taxes made by the taxpayers. According to the NHS Confederation, in 2014, the NHS employed 150,273 doctors. As you can see on the screen, on the left we have a chart of the annual per capita healthcare cost by age. And you can see all the countries do rise a bit as age progresses, but you can see the United States dramatically rises compared to the other ones, which the UK is the blue right here, which rises around age 70. The figure on the right, you can see the annual medical costs for a family of 4. And this is for the United States, and you can see it's been a relatively constant rate going through each year, and it's probably going to continue to rise. So, in the end, there are many differences between these two different healthcare systems, socialized and privatized, but both governments of these respective countries are trying to constantly improve and expand on these healthcare systems, making it more accessible to the American people. Thank you.